Welcome back. So, you're met with Biggie again. But now you have placed an esophagostomy tube, and she is doing better because now she is able to eat. Not literally, but the nutrition goes through the tube and into Biggie's stomach. How do we actually do this? How does it work? And how can we assure that it works for our patients? Let's begin. Esophagostomy is the creation of a surgical incision into the esophagus for placing of an esophagostomy tube. This is indicated for patients needing long-term nutritional support for more than a week to 3 to 4 months or even longer, provided they have a normal esophagus and gastrointestinal system. This is commonly done in dogs and cats. However, recently, dogs have been shifted to nasogastric tube feeding instead of esophagostomy tubes. Why do you think that is? Number one, nasogastric tubes are more tolerated by dogs. As of course with cats, placement of nasogastric tubes is very, very difficult unless the cat is very big. Because just look at the external nares, they're quite small as compared to these guys. Right? Another thing is that dogs tend to tolerate nasogastric tubing better than esophagostomy tubes. They tend to scratch this area and cause premature dislodgement of the tubes. That's why nasogastric tubes are preferred, and they are just placed with an E-collar to prevent scratching. So those are some of the reasons that some of the doctors I've worked with pointed out. But I am hoping you could find another answer for that. As we discussed, esophagostomy tube placement is indicated as enteral hyperalimentation route for patients with a functional GI tract from the esophagus distally. Thus, it is contraindicated for patients with esophageal dysfunction and those with persistent vomiting. Large, large bore tubes from 12 to 14 French can be used, which allows more diet forms like blended specialty diets. For example, you have your canned diets of hepatic or gastrointestinal or renal. They can be blended through a blender, so you would have this pasty consistency of the food, and you could easily feed it to the animal through the esophagostomy tube. This procedure facilitates rapid and easy tube placement. Easier care is necessary for maintenance of the tube. It's easier to feed the animals with esophagostomy tubes, and it can be removed easily even without anesthesia. Client compliance personally plays a big factor when you are considering placing an esophagostomy tube. If you think the owner cannot is not compliant or would not be able to maintain a tube and would not be that caring to blend the food for their cats, take care to feed the cats 3 times a day, then esophagostomy tubes might not be the choice for them. It is found to be well tolerated by cats because it does not interfere with eating or drinking, as long as they are secured as such in these cases. They do not interfere with the normal behavior of the cat, and it is fully secured to their bodies. Because of its position, it also eliminates the complications associated with pharyngostomy tubes. The only major disadvantage for esophagostomy tube placements is the need for general anesthesia for placement. Instrumentation for esophagostomy tube placement is very accessible. All you would need are curved Rochester Carmel forceps or long Kelly hemostatic forceps, non-absorbable suture materials, scalpel blade, scissors, needle holder, induction cap right here, or a heparin cap, it's fine, and bandaging materials such as gauze roll, soft band, vet wrap, or elastic bandages. The esophagostomy tubes may be made of flexible soft silicone, like those used in urinary catheters, or those made up of red rubber latex. The tip of the tube has lateral openings, as you can see right here, and the opposite end has a funnel-shaped lower lock port for syringe attachment. You can see right here. Some even have a retention cap built in already. Different sizes can be used depending on the size of the patient. To learn about the patient preparations, click on our next video.